Okay, so we just finished up with our cardiovascular assessment, and we're going to move on to the peripheral vascular assessment. So just like with any other assessments, you start off by inspecting. I'm going to start with the upper extremities on this patient, and I'm just going to note the color of the extremities, making sure that on both sides the color is the same. Just like we talked about in the unit this week, it's super important when you're assessing the extremities to make sure that you assess them bilaterally. And then I'm just going to kind of feel down the extremity, making sure that the temperature is the same on both sides. Okay, and then I'm going to look at the patient's nail beds here and check for their capillary refill. You're going to depress the nail bed for a few seconds, and the color should it'll blanch, and then it should return back to normal color within 1 to 2 seconds. You're going to do the same thing on the other side. And he has no problem with that there. After that, I'm going to go ahead and feel the radial pulse. And you'll want to count the pulse on your patients in a clinical setting just to make sure that's in within normal limits. A rapid pulse or a slow pulse could be indicative that something's wrong. And then you're going to feel the brachial pulse as well. Then on the other side. And it's important when you're listening or feeling for the pulses on a patient that you don't ever use your thumb, because your thumb has its own pulse. So you could possibly be feeling your own pulse instead of that of the patient. And then you can always compare both pulses bilaterally too to make sure that they're symmetrical and equal. And his are. After I inspect the pulses, I'm going to move on to the abdomen, and I'm actually going to, you should be able to palpate like the femoral pulses and the iliac crest and the renal crest. I'm not going to ask this patient to undress, but in a good clinical setting, you would have your patient take his or her pants off so that you could get a good visual and you could feel the femoral pulses. And then I'm going to assess the lower extremities next. Once again, assessing the color of both extremities, making sure that it's equal. And I'm just going to assess the temperature. Let me take the socks off. Making sure that the temperature is equal down both sides. And it is. If you felt that the temperature as you move down the extremity was cooler on one side than the other, first of all, the fact that it's unilateral usually means that there's a local problem. If it were cool on both sides bilaterally, that would probably mean that there was something systemic going on. And a cool extremity usually means that there's some sort of an arterial deficiency, and if it's hot, it's usually a venous sufficiency. So his temperature is good. You can even assess the capillary refill on the patient's toes if you want to. And always do it on both sides, and his capillary refill is fine. You want to assess the pulses on the lower extremities as well. Start by assessing the pedal pulse. Making sure it's equal on both sides. After that, we're going to go ahead and feel the patient's popliteal. So can I just have you flex? There you go. Kind of cut both of your hands around and move your fingertips outward until you're able to feel that pulse. Might take a little while. This one's a little bit tougher to feel. Okay. Okay, and then the last pulse you're going to feel in the lower extremities is the tibial pulse. This one is felt right behind the lateral malleolus.